I wish you all a very happy and safe new year. Thank you. Merci.
Go to the phone lines for questions. Just a reminder, one question, one follow-up. Over to the first question, please.
From Chris Rushery at the Toronto Star. Please go ahead.
Hi, thank you for taking my questions. With regards to the limits to PCR testing, does this mean that the province will no longer be able to estimate daily COVID counts? And is this information, shouldn't we know this information? I mean, don't hospitals, for example, rely on case counts to predict waves or surges or demand for beds and ICUs?
Thanks very much, Chris, for that question. And we now very much are aware that we have widespread community activity. If you look at the percentage of tests that are positive, it's almost a third to 40% of the tests that are positive across Ontario. And well over 90% of them are Omicron. And hence additional knowledge through that surveillance is not necessary, as we can anticipate for the next 6 to 8 weeks that we'll have widespread community activity of the Omicron variant across Ontario. We will have additional surveillance, as I mentioned, through hospital sectors, monitoring COVID admissions. So causative admissions, those that are having pneumonia in particular related to COVID-19, as well as all admissions to the intensive care unit. So we'll continue to monitor the tests that we do receive through PCR, their percentage of positivity, but our focus is really on protecting the healthcare system, protecting the long-term care sector, learning from the last 20 months in terms of protecting the most vulnerable citizens that we have. And that is our key focus. I do realize that people had been monitoring the total daily test positive count rigorously, but we have to pivot. We know there's ongoing community activity across Ontario. We know we'll have very high transmission risk, and that data element now has to be targeted and focused to best protect Ontarians, to screen those that need treatment, to screen those that are working in our highest risk settings, to best protect Ontarians. So I hope Ontarians will understand that we have to shift, we have to pivot, given the sheer infectiousness of this virus.
Follow up.
Thank you. And as for school reopenings, other provinces have already delayed classes for about a week, in part to provide some kind of buffer in case of transmission with all the holiday socializing. Why did Ontario settle on 2 days and not a week?
So we did have preemptively distributed those 11 million tests. So children will be receiving further instruction on how to use those tests prior to the reopening of school. But the Minister of Health, in partnership with this office, had already given direction on testing before the return. So we have that safety buffer to ensure children don't return to school who test positive, and they don't need confirmation once they have a positive RAT. We also have modified and changed our screening tool to ensure that it additionally monitors for symptoms on a daily basis. And as the Minister of Education has said many times, the investments that we've made in improved masking for educators, improved masking for children, improved ventilation, make our schools very safe relative to any other areas of the community. And our children have sacrificed a lot in the last 20 months. And I think it's a positive statement to ensure our schools stay open for the students that have sacrificed so much for their own mental, physical, and social well-being. So I applaud the minister. He's been single-minded with his approach in ensuring that our schools remain safe and remain open. And I absolutely endorse them opening on January 5th. And I do think the rest of my colleagues, the pediatricians, Hospital for Sick Children, CHEO's Association, all of them, and the Science Advisory Committee are very supportive of this as well.
Next question.
From Anthony Fury at Post Media. Please go ahead.
Hi, Dr. Moore. I wanted to ask you about the incidental hospitalizations and how you say you'll be changing the way those numbers are reported. We've heard from a couple sources that it's believed that the number of incidental hospitalizations among the general hospital tally for COVID-19, about 50% of them are people who are in fact in hospital for other reasons. not suffering from COVID-19. I was hoping you could comment on where your impression is that the figure actually lies, and also how it plays out among ICU numbers. I know you alluded before in past weeks that the ICU numbers were a much more accurate representation of what's really going on, but what percentage of those do you believe are incidental as well?
So thank you so much, Anthony, for that question. This is really important intelligence for us. It has been for a while. We've never had a virus become so prevalent in the community that people would be coming in incidentally, so at significant numbers. We've had preliminary conversations with Kingston, Frontenac, Lennox, and Addington with their hospital sector. It's their initial assessment that 50% of their admissions were from incidental. So someone has a broken leg. If they're admitted, they all get screening testing and they're testing positive. We don't want those numbers contributing to our understanding of the burden of hospitalizations in Ontario. And so we've asked all of our hospital partners to be more vigorous in their reporting so that we can provide a reliable source of data to decision makers and to Ontarians on the impact of COVID on our hospital sector. This is essential information, and it was very preliminary conversations that we've had that have noticed this as the virus gets more and more prevalent in the community, that you will be getting these incidental. The ICU, given the finite number, are more confident that we have 200 people admitted. They are only supposed to report to us critical COVID-related illness, so I have more confidence in that number, but we are asking them to review it once more to ensure it's not any other person that is after a multi-vehicle collision, they receive their trauma surgery and then get admitted in the ICU. I don't think we should include those numbers if they tested positive incidentally and don't have pneumonia or complications of COVID. So I'm more confident in the ICU numbers, although we've asked all of our ICU partners to review that data, and the memo went out yesterday to all of our hospital partners to provide the best level of data in as transparent a fashion as we can. We will provide that back to Ontarians to be able to monitor it together with our decision makers regarding whether any other public health measures would be necessary to protect the health system.
Follow up?
Dr. Moore, I know you've mentioned a lot of changes to the testing regime in Ontario. In the past couple of weeks, a lot of people would have gotten their hands on rapid tests, either made available by the government or they have purchased them. What are your recommendations to people on how they should make use of those tests now, given what you've just said, and what the sort of personal discretion should be in testing?
Well, thank you for that, Anthony. I really think we need to use, if there's RATs that are available in the community at present, you have to use them judiciously. I would use them only if you develop symptoms. I wouldn't use them to go socialize or visit someone elderly or frail or immunocompromised. They are to be used judiciously. If you develop symptoms and you test positive, you'd need no confirmatory. Given the high risk in our communities, a positive test by an RAT does not need PCR and confirms you have that illness, and you should isolate as per the recommendation. If you're a general member in the community, it's 5 days, and your household should quarantine along with you. If you are a healthcare worker, it should be 10 days, but it can be shortened with negative testing on days 6 and 7 to get you back into the workplace. I do understand that we're going to be looking at work shortages given the high prevalence in the community at present, and we'll be making modifications to those recommendations over time. But this is our best review of the evidence at present of how to use the RAT. To use it to go and socialize, I think is not an appropriate use at this time. You really should be using it only if you develop symptoms and a positive is confirmatory.
Next question.
From Sean O'Shea at Global News. Please go ahead.
Thanks for taking my question, Dr. Moore. I just left the testing line at Michael Garron Hospital. There were dozens and dozens of people there, many of whom are there because their employers expect that they will get tested in order to be able to be off work or to be able to go back to work. So what do you say, Dr. Moore, to those people who are going to be very confused, and to employers who are going to expect these tests, which you say now will not generally be done anymore?
Yeah, so I hope employees will understand it's a 5-day isolation period. So that is less burdensome for them and less burdensome for an employer. If you return to work after that 5-day period, adhere to all the best practices, continue to mask, continue to practice good hand hygiene, distancing where appropriate, and you'll be able to get back into the workplace. There will be a knowledge translation activity that we're going to have to have. We're going to have to speak to employers that given the limitations that we have for testing across Ontario, they shouldn't be expecting confirmatory testing. They should be trusting that if you've declared that you've had the respiratory symptoms, a fever, a cough, runny nose, sinus congestion, a headache, extreme exhaustion or fatigue, muscle aches, joint aches, all those symptoms that correlate with COVID-19 and correlate well with Omicron, you should stay home for those 5 days. And the employer shouldn't request any additional practices, testing, because for the vast majority of these individuals, if you're immune competent, your viral shedding's down to a minimum, and with the best practices of adhering to masking and hand hygiene, the risk in the workplace continues to be very, very low.
Follow up.
And a follow-up to that, Dr. Moore, how much of this is about trying to keep the test numbers, the positivity test numbers down? You know, when Donald Trump was president, he said if you find more people, you're going to find more cases. So he said to his people, slow the testing down. It sounds like if you slow the testing down, you prevent more tests, you reduce numbers. So how much of this is political and how much of this is about keeping those numbers that are at record levels lower?
Oh, I can assure you, Sean, if we had the capacity, we would offer the testing. This is a finite capacity. I don't think anywhere in the world expected the transmissibility of Omicron. And we have to use that finite capacity to best protect Ontarians. I can assure you, if we had ability to test everyone, 14.7 million people, whenever they got ill, we would have done so. But no country around the globe has that capacity. So this is not to cover up. This is a basic premise of a limited finite resource that we have to use judiciously to best protect Ontarians. We will report the positivity rate of the PCR tests that we have, but the 100,000 test capacity, we're hitting it already. And when 30-40% of the tests are already positive, with a number we've never seen before, we know there's widespread community activity. No one's covering that up. Everyone should be monitoring their symptoms, screening on a daily basis, and protecting their families and each other through adhering to all the best practices that we've learned for the last 20 months. I wish we had more tests, but sadly, this is a global issue, and we cannot at present test everyone that wants one. And I'm sorry we don't have that capacity, but we never actually did, nor does any country. So we'll be as transparent as possible, improve the hospital reporting, improve the ICU reporting, certainly be public with our current case numbers. But I don't think anyone's being fooled that we're not having widespread community activity across Ontario.
Next question.
From Chris Herholt at CP24. Please go ahead. Chris Herholt.
Sorry, Hi. What do employees do if they have a severe outcome, and do they just stumble into ER and ask to be tested? Because that's already happening. Hospitals are already frustrated with that. And now it seems for most symptomatic adults, even older ones who live in the community, this is all that's left for them. So what do we do?
So for anyone with an underlying medical illness, immune compromise, severe underlying medical problems, an assessment center will test you. What we're doing over the coming days is modifying a significant proportion of the assessment centers that if you clinically feel unwell, you'll also be assessed by a healthcare provider. So your blood pressure, your vital signs, your oxygen will be tested. And when therapeutics are available, such as outpatient therapeutics, that is where we could distribute them. So we want to make sure that we take the burden off emergency departments, which are already busy caring for all of those other issues, medical issues, and trauma issues that arrive across all of our cities and communities, and ensure that we can assess individuals who feel unwell, that want to be assessed. And we have around 220 assessment centers where we do swabbing. We're trying to convert a majority of them to be able to do clinical assessments where you can be assessed if you feel very unwell. Testing for rapid antigen can be put in place in those areas for rapid determination if you're positive, as well as PCR. And or referral back to a hospital sector if they deem you to be unstable by any means. So we're looking at best providing care to all Ontarians in a systematic way, and that will be unveiled in the near future. We have to align that telehealth is aware of it, your family health team or primary care providers aware of it, and that we sync them with their local hospitals and emergency departments so everyone is aware of where you can get clinically assessed if you feel that your symptoms are severe or significant. But the testing remains for those that are vulnerable to this virus, that have significant underlying medical issues, and you will be prioritized for the PCR testing given that we want to be able to assess you and provide care to you if you clinically need it.
Follow up.
So
okay,
thanks.
in regards to schools, staff are being given the option of wearing respirator masks. Does that mean there won't be enough for every single education worker? And I'm sorry, there's another question, but there's a lot coming out here. What are children being offered in terms of masking? Is it just the same masks they've been bringing on their own? Are they being offered respirators as well? And also, what does more stringent symptom screening mean? I wasn't aware there was any way to be more stringent, that we already were doing so.
So we've modified the screening tool to include additional symptoms that we've learned from Omicron, and that we think it's very sensitive to the symptoms of Omicron and would best protect the classroom and the workplace setting by having that in place now. In terms of the masking that's available, the Ministry of Education, we have adequate supplies of masks. And a non-fit tested N95 will be available to staff. A 3-ply cloth mask will be made available to students if they so choose. And that together is an additional layer of protection that we hadn't put in place before. The additional measures are as well. I think over 3,000 additional HEPA filters have been put in play and or are going to be put in play in the near future. The additional measures we're doing to protect school is some high-risk activities will be paused. So the music classes where there's potential for a further aerosolization, the high-risk sports, which with high contacts will be paused as well. Cohorting of students will be minimized to best protect students as well. So we've worked over the holidays to review how Omicron spreads, how best we can additionally protect our school setting. I do think our education sector has been more aggressive than most across Ontario, if not North America, in ensuring that our schools remain safe. I'm proud of the work they're doing and that we're going to open to best protect our children and their mental, physical, social well-being, as well as trying to catch up to the education loss that they've had in the last year or so.
Next question.
From Ryan Tamilty at National Post. Please go ahead.
Yeah, Dr. Moore, I'm struggling to understand. It seems like your change to the testing rules here will ultimately leave us with a less clear picture of how the pandemic is progressing. We'll have less understanding of how widely it's spreading, less understanding of even if cases start to go down, we won't be able to see that. Are you concerned about that? Are you concerned that you will have fundamentally less data and understanding of the state of Omicron?
No, I think I've talked over the last many months that we have to focus on the acute care sector, and we're going to refine and provide the best data we can transparently to all Ontarians about the impact of COVID on that sector, because that is the rate limiting step. We want to be able to provide the right care at the right time to the right individuals. I think Ontarians can accept this virus is spreading so quickly with the 30 to 40% positivity, with 13,807 positives today, that we have widespread activity. That's absolutely going to be the ongoing risk in our communities for the next 6 to 8 weeks. So we'll have a rapid ascent in cases. And then a slow, steady decline. We'll be able to reflect that through the testing of healthcare workers in high-risk settings. When we see the positivity go down, we'll be able to judge that the epidemic is slowing as well, or this aspect of the pandemic is slowing as well. And a key focus, though, will be as we see the decline in hospitalizations. That will be a very welcome time when we see that happen. And I think the key area that any Ontarian should be focusing on at present. We've not thrown in the towel. We've got multiple surveillance options that we have in play, calls to telehealth for respiratory-related illness, visits to the emergency department. All of those are key signals that we monitor in real time for emergency department visits, for example.
Follow up?
Yeah, and then on this change to isolation timelines, I guess how confident are you that someone who has isolated for 5 days and returns to work won't potentially spread the virus to other people? Is this just about recognizing, our need to have people doing essential jobs, or are you confident that someone who is 6 days post-exposure isn't a threat to spread the virus?
So really good question. And how we are different than the CDC is that individuals that are eligible for this, adult individuals, are 2-dose vaccinated, so they have a level of protection against this virus. And we know from studies that they have, if they have a rapid ascent, they will have a rapid descent in the amount of virus that they shed. We know most spread, or over 40% of spread, is actually the 2 days before you develop symptomatic. So we lost that opportunity to protect, but most Ontarians are wearing their mask publicly. They may not wear it in their social side, and that's why it's spreading so quickly. And then your viral shedding slows by 3 days if you're a normal host, especially if you're vaccinated. And by day 5, it's petering out. So by 90% of your viral risk of transmission is already transpired by 5 days. Ontarians, because we've been so brilliant at prevention, maintain our masks. So the masks will again prevent source, so me spreading it to someone else if I have a little bit of virus left, and everyone else masking prevents them from receiving it. Now, it's the best quality mask that you can get access to. At least 3 filter is what we prefer in public settings. But these individuals who still have 5 days to go shouldn't be visiting vulnerable individuals, shouldn't be visiting immune suppressed, and should be minimizing their activities in public for those 5 days as well. And I do believe most Ontarians will adhere to this. No one wants to infect anyone vulnerable. And we've been brilliant at protecting each other over the last 20 months. Our adherence to masking, I think, is bar none. And we, as a province, our ability to diminish the risk of Delta, I think, was one of the highest prevention of Delta spreading of any Western country. So I can only thank Ontarians for all they're doing to protect each other, their families, their friends, and their community. I do believe we can do this confidently and minimize the risk to others. And as we know, in the United States, not many people are masking. But in Canada, in Ontario in particular, we've masked all the way through this and are comfortable and confident that we can protect each other.
Next question.
From Chris Simon at Metroland Media. Please go ahead.
Yes, thank you very much for taking my call. I'm just, it seems like the warning bells have been going off for quite a while about this. The health units across the province have been citing that they have been lacking capacity to adequately test and monitor this pandemic. Is this largely, are your announcements here today largely a response to that?
We absolutely are in regular contact with our health unit partners and are very sensitive to the amount of work that they do, how efficiently and effectively they can protect their communities, and absolutely get their feedback on how we should proceed to best protect Ontarians. So we've seen that the individual case and contact management has been very difficult. The numbers now, 13,000 people to be contacted on a daily basis, is well beyond the capacity, and hence how we have to move to protecting the most vulnerable settings and sectors. They're very willing to do that work. We've also stretched our health units by asking them to work throughout the holidays to continue to immunize Ontarians. They've done so brilliantly. 185,000 people received an immunization yesterday. Our numbers have accelerated since we called together on December 12th to accelerate the immunization plan to best protect Ontarians in the face of Omicron, realizing that we didn't have the same level of protection against Omicron as Delta. So I can only thank them. I thank them for their ongoing support, for working so diligently throughout the holidays. I know many have sacrificed for all of us, and I'm deeply appreciative of what they're doing.
Follow up?
Yes, of course. The letter that was issued by 500 doctors across the province, did you take that to heart when making this decision?
Oh, I'm very appreciative of all the support we've had from our colleagues, whether in primary care, pediatrics, and or public health. I assume that you're talking about keeping schools open. My heart is very much warmed when we get the support from our colleagues to protect our children and keep our schools open.
Next question.
From Chris Hensing at CBC Toronto. Please go ahead.
Hi there, Dr. Moore. Just a question on the COVID test here. What does this mean? Would somebody who tests positive for COVID, how do they show if it's on an antigen rapid test, if they require care for long COVID? We know that those experiences have been something that has been difficult for people who have gone through that, trying to get that recognition when they go through those types of programs.
Oh, I don't think there'll be an issue anymore, given that with the community prevalence, the testing for RAT for symptoms of COVID, I think there's a very strong correlation, because when you have so much of a burden in our communities, I don't think many specialists would question. If they had to confirm, there's also the ability to do antibody testing for individuals to show whether they've had an antibody response. But I don't think any specialist at present would doubt a positive RAT in the face of Omicron is a true positive.
Follow up?
And just a follow-up here is around vaccination. A 4-year-old who's turning 5 sometime in 2022, will they be allowed to get that vaccine as of January 1st, or do they have to be 5 at the time of the shot?
Oh, thank you so much. So we're just reviewing that because there is a significant difference in the dose for a 4-year-old and a 5-year-old as per the Pfizer product. We don't have access to that product for 1 to 4-year-olds, but we know there is a dose difference. So if you can give us a few more days, our immunization advisory committee has been so busy helping us provide guidance on the 4th dose strategy for the long-term care. It'll by January 1st, it'll be by birth date, but we want to make a decision on potentially expanding that cohort and their ability to receive a 5-year-old's vaccine in the near future. So I think it'll be by the 5th of January that we'll be making that decision. I'm sorry for any delay.
Last question.
From Oliver Moore at Globe and Mail.
Hi, Dr. Moore. You mentioned early on that we're not seeing, with the recent surge in numbers, a corresponding sharp rise in hospitalizations. I know in Quebec, the research institute that reports to the government there, their modeling shows that hospitalizations over the next 3 weeks could surpass the levels in previous waves in the province, in that province during the pandemic. What are you seeing in the modeling in Ontario? Is there any reason to believe that Ontario is going to be on a different trajectory than what Quebec is modeling?
There are differences between Quebec and Ontario. We embraced boosters a little sooner. We opened it up. At present, 60% of our over 70s have their third dose, which I have to thank every 70-year-old that's come forward and gotten their third dose. I would certainly like to see more. For our 50 to 69-year-old population, I believe we're at 35%. Have received their third doses, and over 3.3 million Ontarians have already received a third dose. So as compared to most jurisdictions in Canada, we're ahead on the third dose strategy, and we're absolutely trying to accelerate that for the coming weeks. That may, I hope, protect further our acute care sector, but I promise you we're anxious about the rapid rise in these cases. Even if a small percentage of individuals get sick, we need to be able to provide care to them. Either through these assessment centers, the emergency departments, or in hospital if necessary, and we're preparing for those contingencies. We're also monitoring this data to make sure it is accurate, reliable, and that we're counting true counts of COVID, because in many other jurisdictions, we know now on reflection, so pediatric admissions, 40 or 50% in many jurisdictions were actually children that were getting admitted for other reasons that were contributing to their overall case count. So we need reliable information in Ontario. We're trying to get it to ensure Ontarians, we're being transparent with Ontarians. Ontarians can see it, but also decision makers can trust it. We hope to have that in the coming days. I am anxious, though. I'm not going to tell a lie about the impact potentially of a significant number of individuals needing care. And we're absolutely working in the background to prepare that. And we have similar modeling as well, and good expertise in Ontario and within the ministry that we're readjusting our models, given that we now know it's 50% relative to Delta on the hospitalization risk, what that means for Ontarians as well.
Follow up, and this is the last question.
Tomorrow is New Year's Eve. What do you say to people who hear the words widespread community spread and think to themselves, everybody's going to get this. It's just a matter of time. I might as well go out and get lit. It's New Year's Eve.
I don't believe that's the way the Ontarians have been. I do think we've all been cautious, we've been prudent, we've been reasonable, and I hope we maintain that. New Year's Eve is, again, just like Christmas has been in all the festive occasions, a high-risk event. Please be cautious, wear your masks, practice your distancing, stay to your small groups, and please protect those that are vulnerable. Anyone immunosuppressed, anyone elderly, we really need to protect them as best, connect with them virtually. If you're going to have any activities, please, if the weather permits, please do it outside in small groups, get the fresh air, go outside and walk, enjoy each other's company. But as we go indoors with larger gatherings, that's where the risk is increasing, and that's hence the reason the public health measures today have been put in place. No one likes ever putting them in place, but it's temporary, and it's to protect Ontarians and to decrease the overall risk of this virus.
Thanks, everyone.